had a lady come and she had 5 wraps. She did everything that I just explained. She had breast cancer. It was a small lump in her breast. They wanted to cut it out and also do chemo and radiotherapy, but she chose this instead. She was late 50s. She continued to do the program. After 6 weeks, she started to eat a little bit of sourdough spelt bread then. She started to eat some Granny Smith apples and grapefruit. She slowly eased a bit of fruit back in. And then she actually rang me 8 months later. She said, "Barbara, I've just had a test from the doctor and I don't understand it." I said, "Read it to me." She read it to me. I said, "Elaine, your cancer's gone. It's gone."
Have you ever walked past the baking soda aisle at the grocery store without giving it a second thought, assuming it was only good for cookies and deodorizing your refrigerator? What if that small, unassuming orange box actually holds the key to solving some of the most frustrating health problems that creep up as we get older? Recent scientific studies and decades of forgotten medical research suggest that sodium bicarbonate, the simple compound in baking soda, may be one of the most versatile and affordable natural remedies on the planet, costing just pennies per effective dose. From easing painful joints to protecting your kidneys and even helping you breathe easier, the evidence is stacking up higher than ever before. Yet surprisingly, over 80% of people who keep baking soda in their homes have no clue about its true medicinal potential, which means millions of seniors are missing out on life-changing relief every single day. Keep watching as we uncover 10 specific health problems that can fade away when you start using baking soda the right way. Number 1, chronic joint pain and rheumatoid arthritis. Imagine waking up every morning with stiff, swollen hands or knees that make it difficult to get out of bed, let alone enjoy your daily activities. That is the reality for millions of seniors living with inflammatory joint conditions, but a 2018 study published in the Journal of Immunology revealed something extraordinary about baking soda that most doctors never mention. The research showed that when healthy human volunteers drank a solution of baking soda mixed with water, their bodies responded by shifting the balance of immune cells away from an inflammatory state and toward an anti-inflammatory one. Specifically, the study found that baking soda encouraged the spleen, an organ that acts like a command center for your immune system, to pump out more anti-inflammatory cells called regulatory T cells while reducing the activity of aggressive inflammation-causing immune cells. For someone suffering from rheumatoid arthritis or general chronic joint pain, this means that a simple daily baking soda drink might help dial down the internal fire that causes swelling, redness, and that deep, aching pain in your joints. The researchers were so intrigued by the results that they suggested sodium bicarbonate could be explored as a potential therapy for autoimmune diseases where inflammation runs rampant, giving hope to seniors who prefer natural approaches over heavy medications with long side effect lists. Number 2, kidney disease, progression, and metabolic acidosis. Your kidneys work tirelessly around the clock to filter waste products from your blood, but as we age, their efficiency naturally declines, and a dangerous condition called metabolic acidosis often sets in. This occurs when the blood becomes too acidic because your kidneys can no longer remove enough acid from your body, and the consequences are severe. Metabolic acidosis has been linked to accelerated loss of kidney function, muscle wasting, bone disease, and even higher mortality rates in older adults. However, a landmark clinical trial published in the Journal of the American Society of Nephrology found that simply adding a small amount of sodium bicarbonate to the daily routine of patients with advanced chronic kidney disease dramatically slowed the progression of their illness. In that study, patients who received baking soda supplements were able to keep their remaining kidney function much longer than those who did not, and they were significantly less likely to progress to the point of needing dialysis. The mechanism is beautifully simple. Baking soda acts as a buffer that neutralizes excess acid in the bloodstream, reducing the burden on struggling kidneys and protecting the delicate tissues from acid-induced damage. Another study followed patients for 2 years and found that those taking baking soda had a much slower decline in a key measure of kidney function called glomerular filtration rate, with some patients even showing slight improvements. Of course, this is not something you should try without close medical supervision, as too much sodium can be dangerous for certain individuals. But for many seniors with kidney concerns, baking soda offers a rare opportunity to support organ health with an accessible, low-cost tool. Number 3, excess uric acid and gout attacks. Of all the sudden, shocking pains that can strike a senior's body, a full-blown gout attack in the middle of the night is one of the most unforgettable and dreaded. Gout occurs when uric acid, a normal waste product, builds up to abnormally high levels in the bloodstream and forms microscopic, needle-sharp crystals that lodge themselves inside a joint, most commonly the big toe. The result is intense redness, swelling, and pain so severe that even the weight of a bedsheet can feel unbearable. While prescription medications exist to lower uric acid, baking soda offers a surprisingly effective natural alternative that works on the same principle. Because baking soda is highly alkaline, when you drink it dissolved in water, it directly neutralizes excess uric acid circulating in your blood, making it less likely that those painful crystals will form. A study published in the journal Arthritis and Rheumatism confirmed that alkalinizing agents like sodium bicarbonate help dissolve existing uric acid crystals while simultaneously promoting their excretion through your urine. Many long-time gout sufferers report that drinking half a teaspoon of baking soda in a large glass of water at the very first twinge of a flare-up can dramatically reduce the severity and duration of the attack. One recent pilot study even tested a topical baking soda lotion applied directly to the skin over a gouty joint, and patients reported a highly significant reduction in pain within just 15 minutes, along with improved range of motion. While baking soda is not a substitute for seeing a doctor about chronic high uric acid, it can be a powerful addition to your home toolkit for managing those unexpected, agonizing gout flares that disrupt sleep and make walking impossible. Number 4, persistent heartburn and acid reflux. There is a reason why baking soda has been used as a home remedy for indigestion for well over a century, long before the invention of pink commercial antacids. Heartburn, that burning sensation that crawls up from your stomach into your chest and throat, is caused by stomach acid splashing back up into your esophagus, a tube that was never designed to handle such corrosive fluid. As we get older, the valve that normally keeps stomach acid in place can weaken, and many seniors find themselves reaching for over-the-counter acid blockers that come with their own long lists of risks and side effects. Baking soda, however, offers immediate clean relief through pure chemistry. When you dissolve half a teaspoon of baking soda in a small glass of water and drink it, the sodium bicarbonate reacts directly with the hydrochloric acid in your stomach, neutralizing it almost instantly and converting it into harmless salt, carbon dioxide, and water. This rapid neutralization stops the acid from burning your esophagus any further, and the relief is often felt within minutes. A review published in Gastroenterology and Hepatology confirmed that sodium bicarbonate is recognized as a fast-acting, effective antacid for occasional heartburn, and unlike some prescription acid reducers that come with concerns about nutrient malabsorption or bone fractures, baking soda is safe for occasional use by most people. The key word here is occasional, because relying on baking soda every single day for months could lead to excessive sodium intake or other imbalances. But for those nights when you eat a spicy meal or a rich tomato sauce and feel that familiar burn rising up, Having a baking soda solution in your kitchen is like having a fire extinguisher for your digestive tract, putting out the flames before they ruin your evening. Number 5, recurrent urinary tract infections and bladder discomfort. Urinary tract infections are unfortunately common among seniors, especially women, and they can cause a miserable combination of burning during urination, a constant feeling of needing to go, and even confusion in older adults. While antibiotics are the standard treatment and should never be ignored for a true infection, some people experience recurrent UTIs and look for natural ways to make their urinary tract less welcoming to invading bacteria. This is where baking soda enters the picture with a clever, scientifically grounded strategy. The bacteria that cause most UTIs, such as E. coli, thrive in an acidic environment, and they have a much harder time growing and attaching to the walls of your bladder when the urine is more alkaline. Drinking a small amount of baking soda mixed with water temporarily raises the pH of your urine, creating an environment that these bacteria find deeply inhospitable. In fact, a study published in the Japanese Journal of Urology followed 33 women with recurrent UTIs who were given sodium bicarbonate as part of their treatment protocol, and after 4 weeks, many participants reported significant improvements in their symptoms, including less pain and discomfort during urination. Additionally, by reducing the acidity of your urine, baking soda can directly soothe the burning sensation that makes UT is so unbearable, offering relief while your body fights off the infection. However, and this is critical, baking soda should never replace prescribed antibiotics for an active, confirmed UTI because untreated urinary infections can spread to the kidneys and become dangerous, especially in seniors. Used as a supportive measure alongside medical care or as a preventative strategy for those prone to recurrent infections, baking soda offers a gentle, affordable way to support urinary comfort and reduce the conditions that bacteria love. Number 6, exercise fatigue and post-workout muscle soreness. You might not think that seniors are concerned with athletic performance, but maintaining strength, endurance, and the ability to stay active is one of the most important factors in healthy aging. When you perform any kind of high-intensity or even moderately intense exercise, your muscles naturally produce lactic acid and hydrogen ions as byproducts of energy production, and these substances lower the pH inside your muscle tissues, causing that familiar burning sensation and eventually forcing you to stop. This process, known as metabolic acidosis within the muscle, is the primary physical limiter in activities like walking uphill, climbing stairs, carrying groceries, or even doing a full session of physical therapy. Baking soda, when taken before exercise, acts as a powerful buffering agent that helps neutralize those hydrogen ions before they can shut your muscles down. A comprehensive meta-analysis published in the Journal of Strength and Conditioning Research reviewed multiple high-quality studies and concluded that sodium bicarbonate supplementation significantly improves performance in activities lasting between 1 and 7 minutes, with athletes able to push harder and maintain peak power for longer periods. For a senior, this could translate into walking an extra block without stopping, climbing a full flight of stairs without feeling like your legs are on fire, or completing your entire physical therapy routine without cutting the last few repetitions short. The standard protocol used in research involves mixing about 1 teaspoon of baking soda into a glass of water and drinking it roughly 60 to 90 minutes before exercise. One important caution is that you should start with a smaller dose, perhaps a 1/4 teaspoon, to see how your digestive system responds, because some people experience bloating or diarrhea if they take too much too quickly. Used wisely, baking soda can help you get more out of every workout and stay active and independent for years longer. Number 7, bone loss and osteoporosis risk. When most people think about protecting their bones, they immediately reach for calcium supplements or vitamin D, and while those nutrients are certainly important, there is a hidden factor that many seniors overlook entirely. Your body maintains a very tight control over the pH balance of your blood, and when your diet or metabolism creates excess acid, your body is forced to pull alkaline minerals out of your bones, specifically calcium, to neutralize that acid and keep your blood pH stable. Over time, this leaching of calcium from your skeleton can contribute significantly to bone thinning, osteoporosis, and an increased risk of devastating fractures from falls. This process accelerates with age because kidney function declines, making it harder for seniors to excrete acid effectively. Baking soda, however, can interrupt this destructive cycle by providing a direct source of alkali that neutralizes blood acid before your bones have to sacrifice their calcium. A randomized, double-blind, placebo-controlled trial published in the Journal of Clinical Endocrinology and Metabolism found that postmenopausal women who took a daily dose of sodium bicarbonate had significantly lower levels of urinary calcium excretion, which is a key marker of bone breakdown, compared to those who took a placebo. In other words, their bones were not being robbed of calcium as quickly. Another study followed older adults for several months and found that bicarbonate supplementation reduced bone resorption markers, suggesting that this simple low-cost intervention could help slow the rate of age-related bone loss. This does not mean you should stop taking calcium or vitamin D, but it does mean that a small amount of baking soda might be an unexpectedly helpful addition to a comprehensive bone health strategy, especially for seniors who follow a high-protein or high-grain diet that tends to produce more metabolic acid. Number 8. Fungal infections like athlete's foot and nail fungus. Fungal infections are a surprisingly common nuisance among older adults, particularly athlete's foot, toenail fungus, and ringworm, and they can be stubbornly difficult to eliminate with over-the-counter creams and sprays. The reason fungi thrive so easily is that they prefer warm, dark, moist environments, and they multiply rapidly when the pH of your skin is slightly acidic, which it normally is. Baking soda flips this entire equation on its head. When you apply baking soda to your skin, either as a paste or dissolved in a foot bath, it creates a highly alkaline environment that is profoundly uncomfortable for most types of fungi, and it actively disrupts the structure of their cell walls, causing them to weaken and die. A study published in the journal Mycopathologia specifically tested the antifungal activity of baking soda against common fungal strains and found that a solution containing 10 grams of sodium bicarbonate per liter was able to inhibit the growth of 80% of the fungal strains tested, which is an impressive result for a simple, non-toxic kitchen ingredient. For a senior dealing with persistent athlete's foot, the routine is simple. Dissolve half a cup of baking soda in a basin of warm water and soak your feet for 15 to 20 minutes each day, then dry thoroughly and apply a baking soda paste to any affected areas. For toenail fungus, which is notoriously resistant to treatment, some people add baking soda to a foot soak and also apply a thick paste directly to the nail, leaving it on for 10 to 15 minutes before rinsing. Because baking soda is so safe and lacks the harsh chemicals found in many antifungal medications, it is an excellent first-line approach or complementary therapy, and many users report noticeable relief from itching and visible improvement in skin appearance within just a week of consistent use. Number 9. Canker sores and mouth ulcers. Few things are as irritating and disruptive to daily life as a painful canker sore right on the inside of your cheek or under your tongue, making every bite of food and every sip of water a painful experience. These small, shallow ulcers, medically known as Aphthous ulcers, can be triggered by stress, minor mouth injuries, acidic foods, or even certain vitamin deficiencies, and they typically take a week or longer to heal on their own. Baking soda offers a remarkably effective two-pronged approach to treating canker sores faster and with less pain. First, because baking soda is alkaline, rinsing your mouth with a baking soda solution neutralizes the acids in your mouth that can irritate the sore and delay healing, creating a calm, neutral pH environment where tissue repair can proceed more efficiently. Second, baking soda has mild antiseptic properties that help keep the ulcer clean and free of bacteria, reducing the risk of secondary infection that could make the sore larger or longer lasting. A study published in the Journal of the American Dental Association found that sodium bicarbonate mouth rinses significantly reduced pain and promoted faster healing in patients with recurrent Aphthous stomatitis compared to those who did not use the rinses. The researchers noted that baking soda's ability to reduce inflammation, cleanse the area gently, and create optimal healing conditions made it an excellent home treatment for canker sores. To use this remedy, simply mix half a teaspoon of baking soda into a cup of warm water and rinse your mouth thoroughly for 30 to 60 seconds, especially after meals and before bed. You can also create a thicker paste by mixing baking soda with just a few drops of water and applying it directly to the sore for targeted, longer-lasting relief. Unlike some over-the-counter canker sore gels that contain numbing agents or even mild acids that burn when applied, baking soda is gentle, soothing, and completely non-toxic, making it a perfect choice for seniors who may have sensitive mouths or be taking multiple medications. Number 10. Respiratory congestion and sinus pressure. When seasonal allergies, a cold or a sinus infection strikes, the feeling of pressure behind your eyes and cheekbones, combined with thick mucus that just won't clear, can make you feel absolutely miserable. Most people reach for decongestant sprays or oral antihistamines, but those medications often come with side effects like drowsiness, dry mouth, or even increased blood pressure, which is a particular concern for seniors with underlying heart conditions. Baking soda offers a natural, side effect-free alternative that works directly on the mucus itself. When you add a small amount of baking soda to a saline nasal rinse or a neti pot solution, it acts as a buffering agent that softens and breaks down thick, sticky mucus, making it much easier to flush out of your nasal passages and sinuses. The alkaline environment also helps reduce the inflammation of the sinus tissues themselves, relieving that painful pressure sensation. Additionally, gargling with warm water and baking soda can soothe a scratchy, sore throat that often accompanies respiratory infections because the baking soda neutralizes acids produced by bacteria and reduces irritation of the pharyngeal tissues. A study published in the American Journal of Rhinology found that buffered hypertonic saline solutions, which are essentially salt water with baking soda added, were better tolerated and more effective at improving nasal congestion and mucus clearance than plain saline alone. The authors noted that the addition of sodium bicarbonate helped maintain a more comfortable pH balance in the nasal passages while enhancing the mucus thinning effect. For seniors dealing with chronic sinus issues or recurrent upper respiratory infections, incorporating a baking soda nasal rinse once or twice daily can be a game changer, reducing the need for medicated sprays and providing drug-free relief from congestion and pressure. If you have been keeping this humble orange box in your kitchen only for baking and cleaning, you now have 10 powerful science-backed reasons to start seeing it as a versatile health tool that costs almost nothing to use. I would love to hear which of these 10 remedies you are planning to try first, so please share your experience or any questions you have in the comments section below. Do not forget to subscribe and hit the notification bell so you never miss another video, because we are always digging up the most overlooked, affordable secrets to help you live a healthier, more vibrant life.